I would add one point about the need for advocacy for cluster headache and TACs, because patients who live with cluster headache are often very isolated because it's rare. Imagine if people with migraine feel isolated, and it's one of the most common disorders in the world. It speaks to the stigma on this. So I've seen a lot of patients with cluster who did not talk about it, did not speak up, were suffering in silence. And I believe that Cluster Busters, which is an association led from the States, has done excellent work. But we probably need more patient associations for peer-to-peer support, and so patients can speak up, especially with the risk of suicide in this population, extreme suffering. These people need structures that will allow them to speak up, to find help, and not to go to the extreme solution of suicide that sometimes they unfortunately consider. So I send a word to all patient advocates out there. If you want to start something for cluster headache and other TACs, I think that's a much needed structure that we need.